I want to talk briefly today about a technique that's becoming more and more popular called a deep plane facelift. Now, I've discussed this in the past, so I did a video where I talked about the anatomy. I had a little diagram that showed kind of the different layers that are involved and kind of the players at hand, why people do this approach, rationale behind it. And really what it boils down to, again, we'll link the video that I had done previously to this one, but really what it boils down to is there's different layers of the face. Those layers are the skin layer, subcutaneous layer, the smaz layer, which is a connective tissue layer, and then a deeper layer to that called the parotid fascia. And in between the smaz layer and the parotid fascia is the deep plane. Now, because this is becoming so popular, so many people are talking about it, really the best surgeons in the world are all using deep plane facelift. And I'm convinced that this is the gold standard. This is the way to do a facelift. Most natural look, best result, best lift, most durability, never stretched, weird, tight, but just huge improvement. And so again, I am convinced that this is the best way and approach to do a facelift. After 16 years in practice, thousands of facial procedures, I think it's the correct way. Now, one of the things that I think is happening is because this is becoming so well talked about, so versed in different corners, is that people are advertising that they're doing a deep plane facelift, and in reality, they're not. And so the point of our discussion today is I want to talk about 5 ways that you can identify that your surgeon is doing a deep plane facelift or doesn't necessarily know exactly what it is, but is just kind of advertising this. Okay, way number 1. If your surgeon is talking about smaz, high smaz, pulling on the smaz, things like that, they're likely not doing a deep plane facelift. Now, the smaz is involved in a deep plane facelift because it makes up one of the layers, right? It's the outer layer between the parotid fascia and the smaz layer. That's where you need to be. And so there is some mobility that happens with the smaz, but it's not primarily a smaz lift. A smaz lift is different. And so a deep plane facelift should not be confused with a smaz lift because you're not in the deep plane when you're doing a smaz lift. Point number 2 is if the dissection does not go into the deep plane, and what a lot of surgeons will do is they'll stop their dissection at the anterior border of the parotid. And the reason they do that is because the nerve emerges past the parotid, and so they feel like it's safer. Now, again, a deep plane facelift does take more technical skill. You certainly have to understand, know the anatomy, but it doesn't mean it's dangerous. It doesn't mean that you're going to have an injury to the facial nerve as long as you know what you're doing, where you're at. We've done hundreds and hundreds and hundreds of deep plane facelifts, and I've never injured the nerve. So again, it's something to be aware of, but if they're stopping at the anterior border of the parotid and they say it's dangerous to go out there, they're not doing deep plane facelifts. The question number 3 that you can ask to see if they're doing deep plane facelift is where are they dividing the osteocutaneous ligaments? Now, the reason why a deep plane facelift is to me the gold standard is because you have to divide these connections that our face has between the bone and the skin. So there's these ligaments that extend from the bone. So there's ones here called the zygomaticocutaneous ligaments, parotocutaneous ligaments, masseterocutaneous ligaments, mandibulocutaneous ligaments. And if you don't cut through those ligaments, you can't move it, like it doesn't pull. You pull on it and you can hold it there for a while. You can suture it into position for a while under a lot of tension, but eventually those ligaments win. And so kind of the foundational principles to a deep plane facelift is that you have to divide those ligaments, and it gives you the ability to slide everything into a new position where it used to be 15 or 20 years ago. Now, dividing those ligaments can happen anywhere from the bone to the skin because those ligaments transverse across all of these different layers that I talked about. And really the definition of a deep plane facelift is you have to divide the ligaments between the smaz layer and the parotid fascia in the deep plane. That's where you cut through the ligaments. If they're dividing the ligaments in the subcutaneous plane, yes, you can get some mobility, but it's not the same mobility that you get when you move that deeper tissue and block. You don't get the same results, and you certainly don't get the same durability. So if they're dividing the osteocutaneous ligaments, not in the deep plane, but in the superficial or subcutaneous plane, it's not a deep plane facelift. Point number 4. Look very closely at what has happened in the person's midface. So the technique we use for deep plane facelift frees up the zygomatico-cutaneous ligaments, which are the cheek retaining ligaments that hold the cheek into place. And I've mentioned this a couple other times, but with a deep plane facelift, you should definitely see movement in the midface where the cheek goes back up on top of the malar mound. And so look very closely at before and after pictures and make sure that you can see some movement in the midface. Now, it shouldn't be unnatural. It shouldn't be so tight that it effaces or flattens completely the nasolabial fold, but you should definitely see motion and movement in the midface. And that is one of the biggest benefits of a deep plane facelift over other types of facelifts. The fifth way that you can tell is that we only really do deep plane facelifts here in my office, and so we wish everybody would come to my office. And if you'd like to schedule a consultation, of course we're happy to see you, and you will get a true deep plane facelift, extended deep plane facelift that goes all the way out, gives you durability and all the benefits that come with a deep plane facelift. So the fifth way is just to come see Bitner Facial Plastic Surgery.